You're listening to Nutrition Matters podcast with Paige Smathers, registered dietitian nutritionist. Nutrition Matters podcast explores how to approach food and your body in a whole new way. I interview people who share stories and expertise in rejecting diet culture, making peace with food, and discovering a more positive, realistic, and sustainable approach to health and well-being. I'm Paige Smathers, registered dietitian nutritionist, and owner of Positive Nutrition, an in-person nutrition therapy practice in Salt Lake City, Utah. I offer free resources, including this podcast, a blog, and posts on social media. If you're local to Salt Lake City, check out our services and availability for appointments, and keep your eyes out for in-person groups on mindfulness, intuitive eating, body image resilience, and more. Go to positive-nutrition.com and hit subscribe if you'd like to keep in touch. I also offer online courses covering topics like the science of nutrition, mindfulness, and healing your relationship with food. Check those out at positive-nutrition.com/academy. If you like what you hear on the podcast, you can make a difference by leaving a review, sharing with friends and family, or making a donation. Thank you so much for your support. You can also find me on Instagram or Facebook if you'd like to have a little more food for thought at Paige Smathers RD. Thank you so much for listening. Hello, everyone, and welcome to Nutrition Matters podcast. I'm so glad you're joining me. My name is Paige, and I'm your host. And before we dive in to introducing the guest today and the topic, I do just want to let you know, just in case you didn't hear last time I published an episode, I have something new that I'm doing where I am making it officially, the podcast officially kind of able for you to support it if you desire. So what that looks like is that's $5 a month or more if you want. And what you get in return is you get access to exclusive content from me, where I will do, every month I'll do a Q&A podcast, I'll do a nutrition lesson, and then also I'll do a guided meditation. So those things will just only be exclusively available to podcast supporters. And this year, I've kind of planned out the year as far as topics of what I'll do for the nutrition lessons. I thought it would be kind of fun to let you know what's on the docket. So I've already done a lesson on emotional eating. I will also be doing one pretty soon in February on busting weight loss myths. I'll talk about how to navigate confusing messaging in the health at every size and intuitive eating world. In April, I'm planning on talking about body image and why it's important for our health and happiness. In May, I'm planning on talking a little bit about meal planning. In June, I'm planning on talking about when healthy eating becomes harmful. In July, I'm going to be talking about the religion of dieting. And then I'll talk about mindfulness and nutrition, navigating eating out. I'll talk about Halloween during October. In November, I'm planning on talking about family gatherings and food. And then in December, I'm talking about what to do when people in your life just don't get it. So this is what I have planned for the year. Again, every month will also include a guided meditation and then also a Q&A podcast episode as well. So just to clarify, the interviews that I do with my guests will remain free, but if you've been positively impacted by the podcast, if you have felt like it has been helpful for you, if you'd like to support it, that would be so appreciated. And in return, you'll also get access to some exclusive content, which should be useful and fun for you as well. So the way that you subscribe or support is by going to the show notes and just clicking on the link there. It's just 2 links. You don't need to create a new login or username, and it corresponds with Google Pay and Apple Pay, so it's pretty easy to do. And thank you to those of you who have already opted in to support the podcast. It's so fun to see those roll in, and I really appreciate your support. Okay, so with that all being said, I would love to introduce to you my guest today. If you don't already know her, her name is Stephanie Reinold, and she does a good job of explaining who she is and what she does in the podcast episode. But just of note, as far as the topic of what we dive into today, she is a psychiatrist, and she is obviously a medically trained doctor, physician as well. So what we're talking about in this podcast episode is kind of doctor to doctor, what she wished other doctors knew about treating patients with disordered eating, with eating disorders, and kind of her own experience of being a patient who kind of flew under the radar, what that was like, and how she found a more peaceful and positive approach to food in her body. And so this is really, I think you'll find it interesting regardless of your background, but we really intend this episode to be a resource for you to share with the doctors in your life, with your doctor, if you feel comfortable. We hope that this is a gentle invitation to, hey, this might be something you haven't learned about or you don't quite understand about your patients. Kind of an invitation to look a little bit at what it might feel like to be someone who is struggling and who is in need of care from a physician, but also would really appreciate maybe a different approach or some different language or even some different questions being asked in the assessment. So hopefully this is a helpful resource for you, and I hope you enjoy it. And as always, thank you for being here. Thank you for being loyal supporters and just wonderful humans on this journey of trying to find a more peaceful and positive approach to food. I really am honored that I am a part of that with you, even a small part, and I am just so glad that you're here. So with that, let's get into talking with Dr. Stephanie Reinold. Hi, Stephanie. Welcome to Nutrition Matters Podcast.
Hi, Paige. Thank you for having me.
Thank you so much for joining me. I am really, really excited to talk about doctors and eating disorders, disordered eating, body image issues. I just I've wanted to have this conversation for a long time, but I wanted to have it with a physician. And so I just thought that this would be a really good opportunity given your training, your history, what you do for work. I think you're just the perfect fit. So I'm really looking forward to diving in.
Awesome.
Yay. So Stephanie, take a minute and talk about who you are, what your background is, how, maybe just a little bit of your story, and then we'll just go from there.
Yeah, sure. I'd love to. So today I introduce myself as a board certified psychiatrist. I have a private practice in Austin, Texas. I was born and raised in Texas. And I also have my online platform, which is really focusing on more food, body image, intuitive eating, anti-diet, all that sorts of stuff, really from a lens of both mental health as a psychiatrist, but also medical from kind of my doctor hat as well. And those of you that aren't aware, a psychiatrist is actually a medical doctor, but we'll get there.
Good clarification. Yeah, I love that because you never know if someone's confused about terminology. So psychologist is a PhD, psychiatrist is an MD with special training in the mental health realm. Is that right?
Correct. Yes. Yes. So just like a pediatrician does a residency in pediatrics, I did my residency in psychiatry, which actually includes quite a bit of medicine, emergency medicine, rotations, neurology. So a lot of my training was actually very medical in nature, even through residency. So I don't want people to get that confused. But
okay. And you're also a mom, right?
And I'm also a mom. Yes, a mom of now 3. My baby is 2 months now. So
how does that feel to say 3? Yeah. Yeah.
It does feel weird.
3 is more than 2, isn't it?
Oh, yes.
That's what I hear.
Oh, yeah.
Awesome.
Yeah. But, I wanted to be a doctor from a young age. I was always a really good student. And I think, my parents kind of probably most well-intentioned parents are like, oh, you're smart. You can be a doctor or a lawyer. What do you want to be? And not in a coercive kind of way, just they saw my potential and, my mom's a nurse and they saw in my personality too, that I probably wouldn't, I kind of like to have control. I like to be the leader. I like to be sort of the buck stops here. And so the field of medicine, being a doctor really was alluring to me. And I wanted to help people. I felt like I had a servant's heart and I really did enjoy all of, science and the human body. And I just found it all really interesting and fascinating. And so, fast forward, I ended up in undergrad, very much pre-med and, this was also the time that I myself was struggling with an eating disorder, was really late high school, early college. And I say that it always came back to the first diet that I ever went on, which was when I was 13 years old. And that kind of started this spell of restriction, which then for me, what do you want to do? You just want to eat. And so I would have these episodes of binge eating, which then turned into bulimia for about a solid year and a half in college. And I had so many risk factors and then also no risk factors. I didn't have really like one huge big trauma. I had really great loving family. I had really great just like internal security in who I was as a person. I wasn't just this super self-conscious kind of person, but I was a massive perfectionist. And I remember
people pleaser perfectionism going on there.
Yes. Yeah, for sure. And honestly, and it's so embarrassing. I've actually never admitted this publicly, but I really think what distilled a complete spiral down into like full-blown eating disorder for me and for everybody, it may not even be like one trigger, but I made my first B when I was in college. And it's silly to talk about now. And as a mom myself, I would just want to comfort my daughter like, oh my gosh, that's so not a big deal. But when you're in it and, I was 17 years old, I was kind of young when I went off to college already. And I just didn't have the capacity to like deal with not being perfect. And so what did I want to do? I couldn't control my grades anymore. So I wanted to control my body. And that was kind of the beginning of the demise, if you will. And ironically, it ended up actually affecting my grades worse, like one semester in particular when my eating disorder was at its peak was my worst semester in college. In fact, I actually made 2 C's. And in the pre-med world, that's like a death sentence. You're like, oh my gosh, I'm never going to be a doctor. My whole life is, over. And so it really took me a lot to get out of that space, to know that my identity is not in food, but it's also not in grades and, human achievement and my performance at school. And so that was just a very rocky road. And actually, probably maybe because of that or not because of that, maybe completely unrelated, but the first year I applied to medical school, I got rejected. And I hadn't applied to that many schools. And so I sort of kind of set myself up for failure looking back on it. But that was equally a massive trigger to just my eating disorder and, all the heaviness that comes with that, because I was really trying to reclaim who I was as a person at that point, because I had put my identity in kind of 2 things, in being perfect. And really that was kind of having perfect grades and the, perfect career path for myself. And also like eating perfectly and being the healthy person and looking perfect. And neither one of those things were going so well for me. So I was like it was a crisis, really.
I bet that was so challenging, especially since you said earlier that you really, in retrospect, felt like you didn't have the capacity to deal with being imperfect. I think that's like a really, all of that happening all at once, given your propensity towards perfectionism. I can just see that would be a perfect storm.
Yeah. And, I think the sad thing throughout all of this is my grades were so public. My parents paid, I was blessed. I had quite a bit of scholarships for undergrad, but then they also paid for the remainder of it. And so because the deal was because they paid for it, basically I don't know how else to say this, but like they kind of felt like they could be very involved. I'll put it that way. So they saw my grades, in fact, I think my mom, it was through some program through her work that my college was paid for. And so I had to show my grades to
that makes sense.
Anyway, something like that. And so that was very public. And yet my eating disorder was so much a secret, which is the story with so many people, and I flew under the radar because I was in a normal sized body, even when I was massively restricting, and I never really fell below these crazy BMI standards. And so I really never, and I had all these symptoms, like I had horrible migraines and these stomach aches. I had these almost like passing out kind of spells. Like I wouldn't completely pass out, but I'd get incredibly lightheaded to the point where like I'd be taken out of school, even, my senior year of high school and, my first year of college, like I couldn't go to class and all these physical manifestations and I would tell my parents about this stuff. But of course, no one ever thought it was my like eating disorder. They were just like, you're just stressed. You just need to calm down, So then it became this further source of shame that, oh, I'm just like a stressed out person, like I can't even control my personality. Like it's stress that's causing all these bodily problems, that's causing this, perpetuation of this eating disorder, that's causing me to not be successful in my life. And it's just a really massive downward spiral. But I see this pattern really interestingly that our medical issues and our public persona is so public. It's in the word. And yet the behaviors and the mindset is so much often a secret. And that was definitely my story too. So once I got into medical school, I will say, I met my husband right before starting medical school, and I think it was coupled with that relationship, which was just a very positive, loving relationship. Still to this day, he's my best friend in the whole world. And, and with kind of seeing like I was succeeding in life, I became sort of recovered. And it's not like a great story. It's not just one thing, but I think the story is that I didn't need to suffer as much as I did, I wish that throughout that time I had gotten better medical care, because I had gone to so many doctors. So many doctors. And I had sort of self-diagnosed myself with, gluten intolerance. So I, cut out all these foods. But once I was actually in medical training, it wasn't an eating disorder mind, but it was still very disordered. Like I think a lot of mainstream medical providers can be, unfortunately, just because of the training that you're in, that it is a very weight-centric environment. And so I was very judgmental of patients in larger bodies. We were very condescending to patients, on our medical floors. And I saw this firsthand, everything I read about now that, people in larger bodies get, worse healthcare, or they don't get taken seriously. I was one of those people in my medical training.
Well, and you also were on the receiving end of weight stigma when you were in the midst of your eating disorder. Your behaviors were definitely not health promoting, yet you flew under the radar because your medical providers would take one look at your body and deem you healthy without maybe asking more questions. So that's one really important point that I think we all need to kind of contend with. Is sometimes it feels like, oh yeah, this whole like conversation about weight stigma, it's like, okay, I can see how it's true for this situation, but what about that? And we just have to remember, it's like it affects all of us, and it's all of our responsibility to look at it in ourselves and to work on it, if we're clinicians, to work on our own sense of bias as we interact with people that we care for. Because it is, nobody is immune to the effects of weight stigma.
Yeah, absolutely. I say all the time, I think weight stigma is bad for people in thin bodies. It's bad for people in large bodies. It's bad for all of us, because whether you're not being taken seriously for actually serious problems, or it's funny because the story we always hear is someone in a large body goes to the doctor, they really just have a common cold, but they're told to lose weight. Well, that same story, like me, I actually, it's funny because that exact same example, I would get strep throat so frequently. I remember, it would happen 4 or 5 times.
I just had strep throat as an adult, and it knocked me out. It was the worst.
Awful.
It was so bad. I can't even do it justice by describing how terrible I felt. So I'm so sorry you had that so much. That's awful.
It's awful, but never once did anybody in those moments when they saw like how sick I was, and I was getting like so many, like I was getting like bruises on my body, and like I said, like I saw a hematologist, I saw a cardiologist because I was having these kind of syncope, like lightheaded spells. They referred me to a neurologist for like my migraines. I got an MRI of my, like I had this like $1 million medical workup, and never once did anyone ever ask me about my relationship with food, how I was eating, how I was working out, nothing, because they did. They probably looked at me and they were like, it couldn't possibly be anything she's doing there. And yet on the flip, someone in a larger body is judged the other direction. They're like, oh, of course they're probably not working out. They're not eating right because they're in this larger body. Like, so it's both
well, and
sides.
the answer is always lose weight regardless of the ailment. Meanwhile, maybe you're not checking for doing like a full workup for X, Y, or Z health condition because you just assume it's weight related, when really in the end, like, things can fly under the radar there too, which is just so tragic.
Totally. It's really interesting because one of the most fascinating cases that I still remember to this day, and I don't remember it unlocking, unfortunately, anything in terms of like weight neutrality, but now understanding, health at every size principles and understanding weight inclusivity in healthcare, I now look back on this case and I'm really thankful. It was actually on an OBGYN rotation, and it was a woman. She had a gynecological, like, abdominal procedure. I'm not sure what the procedure was, but she was in a larger body. And she had like a wound infection. And so she was on the unit for quite some time that we had to just continue to monitor this infection. And I will never forget, the most interesting sort of bedside conversation was the doctor talking to the patient about nutritional status and actually the importance of wound healing and the importance of like eating enough food, like enough nutrient dense food, and never once talking about the size of the woman's body, never once making like her weight or her, the flesh around the wound an issue or anything like that, but truly really wanting her to know she needs to be eating and caring for herself in order for her wound to heal. And it was so interesting because then we walk out of the room and the same doctor says to all of us, she says, people, of course, she used, obesity, and, it's fraught with so much more emotion. But, she was saying like people in larger bodies, essentially, I will say that, but she used other language. She's like, people in larger bodies, we have to especially check for their nutritional status because most of these people don't eat very much, or their diets don't include, again, there was a judgment there, but it was a learning point for me now, kind of coming full circle, that everyone probably has low nutritional status if we've been dieting for so long, and
you don't necessarily know that by seeing them visually.
Exactly.
Yeah.
Exactly. And so it's interesting when I hear kind of symptoms or like even just, in everyday conversation with friends and family, and they're like, oh my gosh, my daughter or my friend, she's just had all these medical problems. And like, I'm so attuned. I'm just like, I wish someone would ask them about their food, like, it's not my place, but I wish their doctor would be asking them about their nutritional status because it does affect you so much.
Yeah, absolutely. So what helped you shift, Stephanie? Like, what were some moments where you were like, maybe there's a different way to approach my patients that might be a bit more helpful, or that might be more promoting of well-being? I'm just interested to hear kind of what your process was there.
Yeah, so I would say medical school is 4 years, and I was in a dual degree program. So I got my MD, my doctorate of medicine degree, and also my master's in public health. And that combination was incredibly fat phobic, incredibly weight centric. Everything in the public health field is stemmed around, obesity crisis, and that's like all of our medical problems. And so I would say when I graduated medical school, that was definitely still my mentality for sure. And it was, this was right before I graduated medical school, about a month before, was when I had my first daughter. And 2 days before my daughter was born, my dad, who lives in a larger body, he's been in a larger body probably the majority of his adult life, for probably a myriad of reasons. And he had a stroke. And I remember feeling really sad. Okay, the very first thought was judgment. Like, oh, of course, because my dad never went to the doctor. All these, things that now I understand that obviously people are fearful of going to the doctor. My dad hated going to the doctor because every time he went to the doctor, all anybody would ever say is you just need to lose weight. And there would definitely be times, and since even in my childhood, where I saw him and he did lose weight. And then of course, as we know, like he would just gain it back, and his body just liked to be at a certain size. And I saw this like really scary thing happen, and by the grace of God, my dad is doing well now. But in that moment, you hear the word stroke, and it's kind of like the word cancer. Like you're just so scared, you imagine like, is he not talking? Is, like, what are and I was across the country from my family at the time. And, I had just had a baby, and there was just so much going on, and my dad going through rehab after his stroke. And that was probably the first seed that was planted. Like, what could have gotten my dad to go to the doctor? Like, why is it that everyone kept focusing on his body? There's so many things he could have done without losing weight. He could have just
and whether or not he loses weight is hopefully beside the point, right? It's like,
right.
Okay, let me ask more questions than just assuming I know by looking at you. How are you eating? How are you sleeping? Are you hydrated? Are you moving? Are you resting? Just asking some basic questions like that, there's usually like, okay, so there's some room for improvement there. Or we could really set some goals around, regular adequate meals. And the blanket advice to lose weight not only is a barrier to actually going and receiving care from the doctor, because it makes a person just feel like, okay, well, that's all I'm going to be told, so I'm not going to show up. Mm-hmm. It's so mortifying. It's embarrassing for a lot of people. It's really hard to even cope with emotionally. But on top of that, it's like, can we talk about what we're really trying to talk about, which is, hey, how are you caring for yourself? Is there any room for improvement there? And, honestly, no matter the body size, there usually is, right?
Absolutely. Absolutely. Yeah. And it's just so unfortunate that the conversation was always around that. And so then what ended up happening was a complete distrust of doctors. And so, after the stroke, I think it scared my dad enough, and he's had some, cognitive delays now because of the stroke, that I think he now sort of sees he needs to go to the doctor, essentially. But I was like, why did it have to get to that point? And then probably the second big turning point, because I just saw like, this is now like permanent deficits. Strokes, you can recover some, but it's often, permanent, because we can't we regrow parts of our brain, So that was probably the first telling sign that like something we're doing is just not right. Like the medical establishment, and the fact that I hate going to the doctor. It's like, yeah, no one knows your name. It's very impersonal. Like there's like 5 minutes you spend with the doctor. Like, I just felt like care was missing in healthcare. And so being a psychiatrist, that was actually one of the largest reasons why I chose psychiatry, because I saw it as one of the last fields of medicine that you actually have time with your patients, and that you actually can get to know them and actually serve them and actually relieve their suffering and validate them. And, it was kind of the medicine that I always wanted to do when I imagined being a doctor. And so, but probably the second really pivotal moment where like the line was drawn in the sand, like I am never going back to what I consider like diet culture, focus on weight, all that, was in my pregnancy with my son, my middle child, who's now almost 4. And that pregnancy, I was actively, I wouldn't say dieting, but I was very overly health conscious, to maybe like a OCD orthorexic kind of standpoint, potentially like in the first part of my pregnancy, until it got to the point where I wasn't gaining weight.
So Stephanie, really quick, can you just pause and explain what that looks like, just in case someone's new to the podcast? Like, what does orthorexia mean? What does it mean to be overly conscious about health? I know for you and me, that's like, yeah, we know what that is, but it sometimes people are surprised to even learn that that's a thing, that you can be too concerned about health. So just take a minute and kind of describe like what was problematic about that for you. I mean, I think you're about to go there with not gaining weight during your pregnancy. Obviously, that's a red flag. But anyway, just kind of define the term.
Yeah. So I guess I should back up. So kind of most of my life, I've lived in sort of just an average body. So although, diet culture hit me, I kind of never saw health. I never saw my body as unhealthy, I'll say. And so pregnancy doesn't number on the best of us. Okay. Seeing your body change postpartum. So my daughter's pregnancy postpartum experience, I had pretty severe postpartum depression after she was born, my oldest. And really what got me out of that, or what I thought got me out of that, it was kind of a pseudo healing, was exercise and really, quote, cleaning up my diet. And so when I say cleaning up my diet, I meant, you just start like restricting and restricting and restricting.
The slippery slope of restriction, right? It's
yes.
like you can think it's innocent in the beginning with like, oh, I just won't do this. But then it's so interesting how much of a slippery slope that can be. So it sounds like that happened for you.
It can. And, and I, quote, got my body back. So of course, it just was fueling the flame from everyone around me. It was like, you look so good. You just had a baby. And then about a year and a half after, we were trying to get pregnant again, and I had a miscarriage, which I then sort of doubled down on all of these healthy measures, which
quote,
actually
unquote.
Isn't real health, but yeah. Quote unquote, exactly.
Yeah.
And again, then, fast forward some more time and I got pregnant with my son. And so at the beginning of this pregnancy, I was just so fixated in my mind because this kind of orthorexia mindset is very rigid. And so I was so rigid in my mind that I had to continue to be healthy, to have the best pregnancy possible, to have the best outcome, because my pregnancy postpartum experience with my daughter was not perfect, as there is no such thing. But I think in my mind, I was so wanting a perfect experience because I didn't have that the first time. And so the one thing that I could, or I assumed I could control was food. And it really, I wasn't intentionally trying to restrict, but it was restriction because the amount of food I was eating was not very much for a pregnant woman. And so it was about 20 weeks or 19 weeks, when they do kind of the middle of your pregnancy, like the big ultrasound where they check everything. And he was on the smaller side when they first checked him. And so I think they called me back in like 3 weeks to double check it. And he hadn't grown in like that whole period. And I hadn't gained weight in like 6 weeks. So my OBGYN, praise to her, she actually was the very first doctor ever in my entire life that asked me about my food intake. And she asked me about my diet. And it was unfortunately kind of fraught with a little bit of, still diet culture, because she was just kind of like, what are you eating? And it wasn't in a very gentle way, but I will at least give it to her that she opened that conversation, that food could be the issue. And the fact that I'm not eating enough could be the issue.
And isn't it ironic that you were trying to have the perfect pregnancy and eat perfectly, yet that was the source of the lack of weight gain and lack of your baby gaining weight too? Like,
exactly. Yeah.
I mean, exactly. I'm not trying to like come off like I'm blaming you, but we need to point that out. Like it's, right. And whether we're talking about pregnancy or we're talking about other stages of life or other things, that's so often the case, right? It's like the quote, healthier you try to eat, often the worse your overall health is. And also like from a nutrition perspective, yes, the worse you're fueling your body, and you're not really in fact promoting your well-being. So
exactly,
that's what we mean when we say, quote, like too healthy or like too concerned with health. Is there is a balance here. It's obviously we want some awareness and we want to connect with our bodies and we want to understand what helps give us energy and fuel our life. Sure. But you can also take that way too far and you will not be healthier for it.
Totally. Yeah. Which is exactly, and yeah, it's exactly, my case. And it was so funny because I ended up being referred to high risk, and, to make a long story short, that doctor also validated, and she gave me specific numbers, and they were very large numbers of caloric content I needed to be eating, which was really freeing for me. And it's so funny because it was the first time in my life I was actively trying to gain weight. And two things happened. One, it was so freeing. I mean, I remember Googling actually that day that I had left the high risk doctor, and I had Googled because I didn't want to diet, because it's like, don't diet in pregnancy. So I didn't want to diet. So I was like, improve pregnancy health without dieting, I think is what I Googled. And the book, somewhere in my searching, I found Intuitive Eating, the book. And that sort of was this, I read that book cover to cover. I went down the rabbit hole of all the intuitive eating professionals and blogs and all that stuff. And I think it just made so much sense to me. It just validated everything I had experienced. It was freeing, mentally, and also physically. It's funny. I share this because I also saw how difficult it really was to gain weight. And, I say this very gently because I know in recovery, oftentimes we do gain weight, but usually it happens very quickly. And then you're going to plateau eventually because your body is going to reach its kind of place where it feels good, and everyone's fear is they're just going to keep gaining weight forever and ever and ever and ever and ever. And I was like, that was not my experience. It was so hard to gain weight. Like every doctor's appointment I would go to, I remember like looking at the scale, like really wanting it to be higher numbers. I mean, I know for you listening, it's so hard for you to imagine this, but like I would actually be very sad if the number hadn't gone up by like the goal that me and my doctor really wanted, because that meant I wasn't being healthy. Like, so I had started to connect that actually weight gain was health for me in that moment.
Well, and the mental perspective shift of shifting from trying to eat the least amount possible your whole life, basically, to trying to eat enough or trying to eat at like enough so that your body actually gains weight. That's a huge mental shift and a huge perspective shift in how you're approaching food. And I just have to validate that, in my pregnancies, it was really, really eye-opening to, for the very first time in my life, have the perspective of, okay, I need to gain weight. It's a very interesting a shift from sort of how we typically culturally think about our bodies, especially just in our current day and age. So yeah, I bet that perspective also probably played a role in why just the mental shift change in like, now I need to gain weight and it's good and it's positive and it's my job to eat, therefore, right? Sometimes that shift can make it harder to eat than when you are dieting. It's really easy to sort of find yourself in that bingey place with food because it's like, it's more of a reaction to the restriction. Whereas if there isn't restriction, yet your goal is to gain weight, sometimes it's such a mental shift that it actually makes eating harder.
Yes. It's just such an interesting experience. And I think everyone has their own journey. So my story is not going to be your story, but I do want to encourage people that the paradox in all of this is that once I got there, when all foods fit, I was pregnant. It was a different mindset. I mean, I ate everything. I was like, okay, give me the cakes, give me like, Cold Stone, like give me ice cream, and it was coupled with other things too. It was a very wide array of food, but I mean, all foods were not off limits, or there were no foods off limits, basically, is what I'm trying to say. And the funny thing is, my son was born perfectly healthy. My physical symptoms completely went away. I actually did, quote, heal myself, but it came from eating a lot more and even eating a lot of food that I had previously deemed as very unhealthy food. And it was just, so I think I just connected those. Somehow it got glued in my brain that eating more, gaining weight equals health. And so I don't really know how that happened. I mean, like I said, everyone's story is a little different, but for me, it was a very black and white thing. Like I just knew I can't go back because I didn't want to go back. I didn't want to have migraines again. I didn't want to have all the physical symptoms. I wanted to feel better in my body. And I connected that feeling better, being nourished, carrying a full-term pregnancy, like growing a child, like having a full breast milk supply, like it was all contingent on the fact me eating enough calories every day and fueling my body. And that starving my body was connected to all these other negative things in my life, not to mention all the psychological issues that came from it. Like I was mentally a more whole, happy, much less stressed person when I was eating enough.
Yeah, and eating enough is way more than culturally we think it is. Like, I'm just going to throw that out there.
Yes.
You know, we don't want to get specific on a podcast format. It's not appropriate, but at the same time, it's just kind of challenging, like, what we think we know about what a, like, adequate, balanced, healthful meal or day looks like for a person is most likely, more likely than not, it is more food than you are imagining in your head right now as you're listening.
Yes.
So yeah, I love that. And thanks so much for sharing that part of your story, because it really highlights, you know, the weight stigma. It highlights your sort of critical thinking and shift in how you think about health and well-being and being a physician, a medical provider, but also your personal story of really solidifying this concept of intuitive eating into your own world, which for sure has informed your medical practice from there, right?
Yes. And one last thing I will add, my medical team, when I would go to these OB appointments and I would gain weight, they were so happy for me. And it was a really, really positive experience that they were like, good job, mama. Like, good job. Like, you know, you gained this much weight. And it became this source of pride to gain weight. And so I think it just sort of further cemented that, you know, in my brain. And it's like, so going down this rabbit hole of now learning, like kind of in my mind now about all the facts that diets really don't work, restriction really doesn't work. It's just like more harmful to your body. It's going to cause worse health outcomes and weight gain in the long run and all this stuff. It just lined up with my experience, my family's experience, my friends' experience. And I was just like, everyone needs to know this. I was like, how, like everyone needs to know this. And it just, but it was also a really hard place to be in, you know, that seeing all of my medical colleagues and everything in the mainstream medical world, you know, is so weight centric. And I am a bit protected from it now today because I'm in private practice and, you know, as a psychiatrist, I don't take weights. I don't even really have to take a weight. Although interesting sidebar, we have to do electronic medical prescriptions for controlled substances in the state of Texas. And I was sending a prescription and it would not let me send this prescription until I put in the patient's height and weight. So now I'm thinking that there's some new regulation on that. So maybe I won't be immune to this for long, which is unfortunate. But I worked in inpatient hospital for the early part of my career for a couple of years as I was kind of building up my side business. And everything is so weight focused. I mean, a person comes in for suicidal thoughts and automatically, if they're in a larger BMI category, they get a dietitian consult, they get a diabetes educator, they get, even if this patient doesn't even have diabetes, you know, there's just this like automatic throttle of things that happen to people in larger bodies. And it's just, it's so sad.
Okay. So let's take a minute to just talk about why that's problematic. Because I'm always sensitive to someone being new to this podcast, or maybe someone listened to this episode and they're sharing it with their physician. And maybe it's their physician's very first introduction to weight neutrality or toward sort of weight stigma or the problems with making judgments about someone's body size. So let's just kind of like spell it out. What is problematic about the medical field being weight centric?
Well, I think the biggest thing that comes to my mind is that you're completely invalidating the individual suffering, like why they actually came to you in the first place. I mean, I had a patient once tell me that they went to their primary care doctor, actually told their primary care doctor, like, I am really not doing well. Like, I've even struggled with suicidal thoughts lately. And this is, a patient that had known depression, on medication, and this primary care doctor completely ignored. And for the record, on this particular case, this woman was in an average size body. So not even in a, quote unquote, overweight or obese BMI category. So this just shows you how skewed the medical field is. But this doctor, and this is coming from the patient, so, one sided of the story, but I believe it because I've heard stories like this multiple times over. This doctor did nothing for her mental health, said nothing about the suicidal thoughts. She told her she needs to go on a diet, cut out carbs, if that's making her depressed, and that she wants to check in with her.
Sidebar, not true. Throwing that out there. So depression is more complicated than carbohydrates.
Oh, that is an awesome quote. So true. Yes, so true. Oh, I went on that diet, by the way. There is, I don't even want to name it, but I'm going to name it because I'm sure you guys have seen it. But it's like the serotonin diet. And it's like, it actually is not anti-carbs, but it's like regulating your carbs. Also doesn't work, just for the record. I ended up on an antidepressant for postpartum depression because the serotonin diet didn't work so well. So no shame in the medication game, and no shame if you want to eat carbs, because not eating carbs is not going to take away depression or anxiety.
Your brain
either.
Also is fueled by carbohydrate. Just throwing that out there. Yeah.
Totally. Oh, man. I don't even know where to go with this but anyway, lo and behold, this patient, because I saw her in a hospital because the suicidal thoughts did not go away. It only got worse. Go figure, because the doctor didn't validate her, didn't adjust her antidepressant at all, didn't give her any hope, didn't even sit and talk to her more than 30 seconds. And so she ends up in a psychiatric unit. I mean, which honestly may not have even been the right frame for her healing either. So, I mean, there's so many layers why it's harmful. I think the biggest being that you're not validating actually why a patient came to you in the first place. And so what ends up happening is really lazy medicine. You don't do a full workup. You don't take a great history because you're so biased on what someone looks like. I often wonder if there would be a study done if a doctor couldn't see someone's body, how they would manage that patient's case based on just the symptoms that a patient is telling them. Because I think patients would get better care, because I think doctors are so skewed based on appearance of somebody. And what's funny too is I've had colleagues that are in large bodies as doctors, and that is a community I do not hear from, like the fat doctor community. I can only imagine they feel so much shame because they themselves are very weight centric and fat phobic, and they're living in this body. I can only imagine that cognitive dissonance they probably feel on a regular basis,
Yeah, that would be really interesting to hear someone kind of share their experience with that, because I know there are some fat dietitians who talk about their experience with doing work in nutrition and having judgment or shade thrown their way about their body. That is really, really challenging for sure.
Yeah.
Stephanie, I'm interested to know, so when we're trying to kind of explore this question of like what's problematic about sending in a dietitian for someone whose BMI is past a certain threshold, I think your point of it potentially can invalidate why the person is there. It gets in the way of potentially doing a full workup or asking more questions to understand what someone's behaviors are like. I think those are really, really good points. I also wonder if from your perspective, being in the medical community, do you think that some of the tendency to kind of not take the suicidality, I don't want to say not seriously, but not refer or not even address or talk about that with this client or this patient that you're talking about, how much of that and how much of patients who might show up with eating disorders or other mental health comorbidities, like how much of that is just the medical field just being a little bit scared to touch mental health stuff and kind of like, I don't even know what to do with that. So I'm just gonna, I'm gonna stay in this realm over here. That one's scary. Talking about feelings or talking about suicidality or talking about eating disorders, that's for someone else. I don't know. I wonder what you think about that.
Well, I think you nailed it. I mean, I think there is not a lot of attention given to mental health issues, even in, and I think it kind of stems back to medical school. Medical school in our psychiatry training, just the way in which format is, you don't often see high functioning patient, like psychiatric patients, which is 90% of psychiatric patients are very high functioning, because the way in which we train and we go through hospitals and, a patient who is chronically ill with a mental illness looks much, much different from, someone like myself, even like listeners who struggle with anxiety, depression. There's a very large spectrum of ability to live, in daily life, like your functioning status. That's what I was trying to say. There's a very large spectrum of like your functional status among psychiatric patients, which is probably the one difference among psychiatric patients versus just purely medical patients. Unless you are a stroke patient or, on your deathbed from some horrible illness, really your functional status, when I say that, like your ability to walk, your ability to talk, your ability to carry on a conversation with people, your ability to pay your bills and, manage your day-to-day life, keep a job, those things are not as dramatically as affected as someone with a psychiatric illness, as you can imagine, because literally it's affecting your brain and all of those things like processing and solving problems and having relationships, you have to use your brain for. So I think it's also too, we can't see it, and we're so visually inclined people. And so we're just now getting to the place even where brain imaging shows a lot of these things. But even still, like an eating disorder, it's why mainstream medical field bases an eating disorder based on BMI, i.e. what someone looks like, which is so unfortunate. And actually those standards have been called out. But because it was that way for so long, now mainstream doctors, it's like, if you don't quote, look anorexic, or you don't look like, a cachectic patient who's like starving to death, then you don't have a bad eating disorder. And because society does glorify this thin, ideal version of beauty, doctors live in the world that we live in. I want to extend so much compassion because the systemic issues of our healthcare system is so far beyond my pay grade. I mean, there's so many issues why doctors are the way they are. I don't think it's just because doctors are evil people. I like
well, and there's so much that goes right with doctors, right? And we need to acknowledge we're so grateful for all the hard work that they do, all the ways that things go well and right. And this is not at all trying to say, all doctors are bad. However, there's an element of learning that I've done, learning that you've done, learning that this community of people who are practicing like their expertise from a weight neutral perspective, just how much better it feels from like an ethical perspective, how much better care you can administer when you're when you're asking questions and when you're leaving your bias at the door and when you're challenging that and looking at that. Yes, that's not a fun process. It's not fun to look at the parts of you that are, a little less than what's the word? I don't know. It's a little ugly sometimes what you see in yourself. And so it's not saying that doctors are wrong or bad. It's trying to say, hey, just a few questions toward what a person is actually doing, believing them, trusting them, and then providing recommendations that are like more behavioral in nature can go a long way. Like, hey, you know what? It sounds like you're not eating until, the afternoon. Do you think you could have like a breakfast and a lunch? And could you eat, a well-balanced, adequate meal, breakfast and lunch? Could you work on that until I see you next? That would go over so much better than lose weight.
Right. Or even if doctors were just honest to say they don't know anything. Like I see so much harm being done by doctors who say, you just need to go keto. You just need to eat, this many calories a day. You just need to go low fat. You just need to do this. And, because this is the patients I hear from, now who are seeing me because of many more reasons than just this. But, and we get like no training in nutrition in medical school. We get a few lectures, but what I knew about nutrition was because my eating disorder was obsessed with nutrition. So I knew a lot from my undergrad, and I did learn some in my master's program in Masters of Public Health, but really not at all like to the point that I would ever feel comfortable recommending a diet to patients. And so I think doctors need to stay in their lane and just be honest with what they don't know. But unfortunately, many doctors, and I say we're a little narcissistic. We want to solve everything. We want to think that we have all the answers, and there's probably lots of reasons why that is, but it's probably personality, just kind of the personalities
who becomes
that
a
go
doctor. Yeah.
Right. Yeah. Like the kind of the personalities that the field of medicine draws in are kind of control freaks. And, we're type A perfectionistic people who it's really hard for us to say, I don't know. So something like nutrition, even if we really don't know, we want to think we know because we read some article from so-and-so medical journal and it says that everyone should go keto for our brain health. And it's like, wait a second. We also learned about research modalities. Why are you not looking at the primary study and how flawed it is? That is some of the calling out of doctors that I get frustrated with is like, wait a second, we actually did learn in medical school about like reading a research study and getting
critical thinking.
Yes. So,
Stephanie, I just have to say, like, I am never not amazed with what comes back to me of what has been said in a visit with a physician. I hear it all. And I also have personal experiences of hearing doctors talk about food and bodies in ways that just kind of make me feel like, oh my gosh, do they really not know that? Oh, wow. Okay. Gluten is not it's not an unhealthy bad thing. Like, do we need to get that basic? Exactly. It is a protein found in wheat, rye, and barley, and so sometimes the things that come back to me either personally or more professionally with clients, just kind of, I just want to validate, like, it is okay to refer out to someone like me who, I have the luxury of spending a lot of time with people. I get to ask questions. I get to build rapport. I get to do a full assessment of what they're eating and how they feel about their food and what their relationship with food looks like. And, whether or not this little quick advice in a doctor's office visit about nutrition, whether or not that's going to be helpful, I'd say more times than not, it's something that they've already heard before and something that they're either going to take too seriously and go down that slippery slope we talked about earlier, or they're going to just write it off and then, again, like you said earlier, kind of lead to more distrust of their doctor.
Yeah. Yeah. Exactly. It's funny, I've done a lot of eating disorder work in my very young career. I say my career, but it's so funny when I say that. So, I never talk about the food though. Like that's why my whole platform is it's not about the food because that's not my lane. Like I try to stay in my lane that it's not about the food. I'm not going to try to give you nutritional advice or, I know from like a lay standpoint of, okay, I'm sure this probably has a little more nutrients than this one, but that's not my lane. Like my lane is the brain. And like staying in your lane as a doctor is a hard thing to do. Cause again, having that little narcissistic complex, like that you just, or maybe like kind of the savior complex, like we just want to save everybody. We want to help everybody. And it's hard to
I think there's lots of good intentions behind it for sure. Yeah. And I think even when your work is nutrition, like me, it's also not really about the food, but it is, right? It's like it is and it isn't.
Right.
Yeah, that's actually, I love that conversation of like, is it about the food? It's like, yes, and it's not.
Right.
Yeah.
And I think it takes a skilled provider to know when to talk about food and when not to talk about food, like that's why I would always recommend a dietitian as a part of someone's team if you are struggling with this, because I think that's the nuance you can get into. Like, when is it about how you're looking at food and when is it really about your diet, like each and every day, because yes, they are both important. It's just not my lane, and I'm never going to talk about that in session.
Well, and it's so interesting, like, even as someone who, I really love nutrition, I really love food, I love talking about it. When it comes to what's important to look at with nutrition on a practical level, the biggest thing I work on with my clients is adequacy. Eating enough is like the usually the amount, like what people actually need help with. Things from there can come, whether we're talking about an athlete training for a certain event, or even like diabetes or certain conditions. It's like, if you're not eating enough, that's the first thing we need to look at. We need to look at that enoughness aspect. So the way we talk about nutrition culturally is often just kind of missing the point. It's like, okay, well, like in your experience, okay, I'm having all of these physical symptoms. Meanwhile, nobody's asked me about whether or not I'm eating enough. And I'm sure a lot of those symptoms resolved with just eating, like you said, eating cake and bringing it on in your pregnancy, like that helped you get up to that adequate level. So whether it was cake or some other food is actually less important than the fact that your body was finally getting the amount of like adequacy it needed.
Yeah, absolutely. And I blame the scale. I blame doctors and society's obsession with weight and with the scale. And, I want to go on the record to say this because I truly think weighing yourself at the doctor is a traumatic experience, and it should be treated, if we're going to continue to weigh patients, which I would dream of the day that weight was not a vital sign like we think it is, that it was actually a side conversation, that even though weight can be a part of someone's health status and a part of a clinical picture, I don't think it's something at the top of the chart that is the most important. And I think if you treat it like a pap smear or an ultrasound, like a source of intervention, like I see it as a psychiatrist as that potentially harmful, that potentially traumatic for a patient, just as a pap smear could be potentially really traumatic for somebody, like looking at a number, getting on the scale. I mean, I just hear from so many people how incredibly traumatic that is, whether or not you are even in an ideal body weight, which we already know that BMI has so many inaccuracies in how it's used in our mainstream medical system. But I really just want to validate too that although doctors are well-intentioned, doctors do cause harm. We take an oath to do no harm, but unfortunately we're human beings. And in the world that we live in that doesn't prioritize health over weight, we prioritize weight over health, unfortunately. And I think that causes a lot of trauma in doctors' offices and patients. I use that word to give language to someone suffering because I think it really should be described that way. Because what I hear from people, I mean, they have all the symptoms almost of PTSD going to a doctor. And so I just want to validate that, because I know that there's a lot of people out there, that will give you tips and advice on how to survive the doctor and how to do this and how to speak up for yourself. And that takes an immense amount of maturity. Like, I have never even been able to get to that place. And I'm a professional who does this work, who lives in an average sized body. So it's funny because this last pregnancy is the first pregnancy I did not know my weight. And I went through the whole pregnancy without knowing my weight. And those who follow me know I had an incredibly traumatic experience. It was a twin pregnancy. I lost a twin. I had really a lot of distrust in my medical team. And a lot of over focus on my weight that I wasn't really expecting. And there was one visit in particular where the medical assistant said my weight out loud. Like I'd always step on the scale, get blind weights. And my husband, who actually happened to be with me, he was like, why did you do that? He's like, are you going to say something? Why did you do that? Like, he was actually more concerned because in that moment, I felt so oppressed. I felt like I didn't have a voice. I felt hopeless, and it was already in a very traumatic, vulnerable experience. And so I just don't want to end this episode without giving voice to that level of suffering, because it's very scary. And so if you're not ever in a place to confront your doctor, that's okay. Like if that's not your personality type, if that's not ever something you feel comfortable doing, that's okay. That's okay. You can always step on the scale backwards. You can say like patient declined. I personally have never had the balls to even do that, but I do know and respect a lot of people who are able to say that. And let alone like getting to the point where you're educating your doctor. I mean, like I said, I've never even gotten to that place yet to educate my own medical team. And I'm a professional who does this. So it takes a lot of a little bit of personality type, like who are you? What are you trying to accomplish? As well as just a lot of healing, a lot of maturity on your own part to even get to a place to have that kind of conversation.
Yeah. And you did such a good job of talking about how it feels on the patient perspective when weight is the most important thing at the doctor's office. I also want to just give voice to, some people, it doesn't bother them to go and get weighed. And if you're listening and you're like, oh, that doesn't feel traumatic to me, am I a weirdo? I just want to say like, no, that's great. That's so awesome. Yeah. If you can move on with life and have it not be a thing, or if you are personality-wise someone who can have a doctor, maybe not have the world's greatest bedside manner and you can move on, like that's so awesome. But what you're saying, Stephanie, is so real. I just want to validate that. I have so many clients who tell me such similar stories about weights at the doctor's office. And I think that the other thing I just wanted to mention is it would be so awesome if weight weren't so important at the doctor's office. And I also want to give some caveats because I don't want to get angry emails, right? So I know that weight can be important in certain, conditions. It can be deemed medically appropriate based on, like many different factors can come into play for you and your team to decide that it's important to, keep track of weight. And so I don't want to make it sound like weight is an absolutely unimportant number. It's just, I think really what we're trying to say is that from a medical standpoint, typically weight is not the most important thing in making clinical decisions. Behaviors overall, at least for what I do from a nutrition perspective, taking the emphasis off of weight as being the end all be all indicator of your health status and really looking more at how are you caring for yourself? What does your overall self-care look like? The more I ask questions like that, the more I can actually create interventions or strategize about what we can do next together in our work together that's going to be actually sustainable, health promoting, practical, all the things we all want when it comes to how we approach food. So more of a behavioral perspective, more importance given to how you're caring for yourself, less weight, if you will, on the weight factor. I think would be a really positive shift that I would love to see in my field too,
Yeah. And, honestly, I've thought about this so much, like, because it's going to take a while to change mainstream medicine, y'all. Like, I'm not expecting that, I'm like one person in a sea of millions, right? But I do think even if you just switched the order of things, like it is so jarring that the very first thing you do, even at a new doctor, you don't know anybody, you don't even know the medical assistant, they don't even ask for your name, they don't introduce themselves, and they're like, "Can I get your weight?" And that's like the first thing that you do. And it's just so jarring. That's like that little piece of trauma that's like, oh my gosh, like I'm anxious now. And then your blood pressure is high. And then this like cycle of shame begins.
And then they're asking you to get naked, right? I mean,
oh yeah, exactly.
That too.
Okay. And then, undress, waist down. You're like, oh my gosh.
Like, are you going to buy me dinner first or ask my name or what?
Like, I would just want to have a conversation with somebody before somebody gets my weight. Like, that's all I'm asking. Like, can we just see the nurse first or see the doctor first? And if you still need to get my weight for the chart, like after I've calmed down, I feel a little more assured in the practice. Like, I feel like someone actually knows my name. Like, just changing the order of that honestly would solve a lot of problems.
Or even if the medical assistant said, you're welcome to stand on this backwards if you'd prefer not to know. Like, even if, like, I've had lots of clients tell me how they just get looks of just utter confusion from the medical assistant when they say, can I step on backwards, or can you not share my weight with me? Just to have a bit of training around, like, hey, weight is kind of hard for people. That shouldn't surprise you, but let's see what we can do to make this a bit more like gentle for people.
Yes. Yeah, just caring, bringing care back to healthcare, actually being compassionate about someone's like emotional well-being at the doctor. There's all these studies like stress like causes all these problems. Well, the doctors are causing a lot of the stress.
Yeah. Well, and I just want to be so fair to them because I know so many wonderful, caring, amazing physicians, and I don't want anyone to leave our conversation feeling like we're saying every single doctor just doesn't care, because that's definitely not true. It's just kind of being open and willing to explore, like, okay, how, like, this might be my intention, this might be what I'm trying to put out there, but how is it being received, and what could I do to see how I might communicate with more compassion, because wow, I'm learning, hey, that didn't come off the way I meant it to, oh, if I say it that way, people hear me a lot better. There's always room for improvement for all of us to look at that stuff.
Absolutely. And I should also say that you can be weight centric and also be a compassionate doctor. I personally never had a doctor that is weight inclusive or health at every size, or however you want to categorize that. Like, I've never even had that. Like, I've always had doctors very focused on weight as an instrument of health, but I've also had my fair share of very compassionate, amazing doctors. So it's not this black and white extreme thing by any means.
I love it. There's so much gray and nuance here that I think we spent a lot of time kind of talking about where we hope some improvements might come, but also it's important to just mention the other side of it is like, there's also so much going well, and there's so much, I'm grateful for as a person who has access to modern healthcare to be able to, get care as I need it. And that's a beautiful thing. And I'm grateful for the doctors who make that possible,
Yeah.
Well, Stephanie, what else do you want to make sure we say before we close?
I feel like I've said it all.
Okay, we've said it. So where can people find you and follow along and kind of talk about what you do and what you have to offer for people?
Yeah. So like I said, I have a private practice in Texas or Virginia. So if you happen to live in those states, I do take virtual and in-person patients in Texas. If you are interested in just more like food, body image stuff, kind of like this conversation, I have various kind of online courses that help you, as well as my podcast called It's Not About the Food. But you can look at all of that at my website, StephanieReinaldMD.com. And my name's spelled kind of funky. It's like Gwen Stefani Reinald, and I'm Stephanie Reinald MD everywhere on social media too.
Okay, and I'll link to your website and people can find those resources from there in the show notes.
Yeah, awesome.
Well, thanks so much, Stephanie, for joining me. It was really lovely to discuss this kind of tricky concept. Thanks so much for diving in with me. I appreciate it.
Thank you, Paige. It was a really great conversation. I appreciate it.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.